Hi, in this video, we will debunk common misconceptions surrounding diabetes and provide accurate, evidence-based information. Our aim is to empower readers with knowledge, challenge assumptions, and promote a better understanding of this prevalent condition. We will address myths such as the connection between weight and diabetes, the role of sugar in causing the disease, and restrictions on fruit and desserts for diabetics. We also explore the misconception that only older individuals get diabetes and that it is solely caused by a poor diet and lack of exercise. While there is currently no cure for diabetes, we emphasize the importance of management through lifestyle changes and medical guidance. By dispelling these myths, we hope to promote informed decision-making and foster a compassionate perspective towards individuals living with diabetes. Get ready to challenge your assumptions, gain valuable insights, and make positive strides towards a better understanding of this prevalent disease. Overweight people always develop diabetes. It is a common misconception that all overweight people develop diabetes. While it is true that obesity is a risk factor for developing type 2 diabetes, not all overweight people will develop the condition. In fact, many people who are overweight or obese never develop diabetes. Type 1 diabetes, which is a different condition from type 2 diabetes, is not caused by being overweight. In type 1 diabetes, the body does not produce insulin, and this is usually diagnosed in childhood or early adulthood. Type 2 diabetes, on the other hand, is often associated with obesity, but there are other risk factors as well, such as genetics and lifestyle choices. It is possible for someone who is not overweight to develop type 2 diabetes, and not everyone who is overweight will develop the condition. It is important to maintain a healthy lifestyle, including a balanced diet and regular exercise, to reduce the risk of developing diabetes, regardless of body weight. Regular checkups with a healthcare professional can also help to monitor blood sugar levels and detect any early signs of diabetes. Only older people get diabetes. It is a common misconception that only older people get diabetes. While it is true that the risk of developing type 2 diabetes increases with age, the condition can affect people of all ages, including children. Type 2 diabetes was once known as adult-onset diabetes because it was primarily diagnosed in middle-aged and older adults. However, in recent years, there has been a significant increase in the number of children and adolescents diagnosed with type 2 diabetes, largely due to rising rates of obesity and sedentary lifestyles. According to the American Diabetes Association, over 5,000 children are diagnosed with type 2 diabetes every year in the United States, and the condition can now be found in children as young as 3 years old. It is important to recognize the signs and symptoms of diabetes and to seek medical attention if you are experiencing any concerning symptoms, regardless of your age. Risk factors for type 2 diabetes include obesity, a sedentary lifestyle, family history, and certain ethnic backgrounds. Maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity can help reduce the risk of developing type 2 diabetes, regardless of age. Diabetes treatment is all medicine and diet. While medication and diet are important components of diabetes treatment, exercise is also a critical aspect of managing the condition. Regular physical activity can help improve insulin sensitivity, lower blood sugar levels, and reduce the risk of complications associated with diabetes. The American Diabetes Association recommends that adults with diabetes engage in at least 150 minutes of moderate-intensity aerobic exercise per week, spread out over at least 3 days per week. This can include activities such as brisk walking, cycling, swimming, or dancing. Resistance training, such as lifting weights or doing bodyweight exercises, can also be beneficial for people with diabetes, as it can help improve muscle strength and reduce the risk of falls and other injuries. It is important to talk to a healthcare professional before starting a new exercise routine, especially if you have any underlying health conditions or concerns. Additionally, it is important to monitor blood sugar levels before, during, and after exercise, as physical activity can affect blood glucose levels. Type 2 diabetes results from eating too much sugar. While excessive sugar consumption can contribute to the development of type 2 diabetes, it is not the sole cause of the condition. Type 2 diabetes is a complex disease that is influenced by a variety of factors, including genetics, lifestyle choices, and environmental factors. In addition to diet, other risk factors for type 2 diabetes include obesity, lack of physical activity, smoking, high blood pressure, and a family history of the disease. Type 2 diabetes occurs when the body becomes resistant to insulin, a hormone that regulates blood sugar levels. This can lead to high blood sugar levels, which can cause a range of complications if left untreated. If you are concerned about your risk of developing type 2 diabetes, it is important to talk to a healthcare professional. They may recommend testing for fasting blood glucose levels, HbA1c, and other biomarkers to assess your risk of developing the condition. Diabetics can't eat fruit. Contrary to popular belief, people with diabetes can eat fruit as part of a healthy diet. Fruit contains natural sugars, but it is also a good source of fiber, vitamins, and other important nutrients. It is true that people with diabetes need to be mindful of their carbohydrate intake and monitor their blood sugar levels, but fruits can be included in a balanced and healthy meal plan. According to the American Diabetes Association, one serving of fruit typically contains about 15 grams of carbohydrates. This means that people with diabetes can enjoy fruits in moderation, while still maintaining healthy blood sugar levels. To help manage blood sugar levels, it is important to pair fruits with a source of protein or healthy fat, as these nutrients can help slow down the absorption of carbohydrates into the bloodstream. For example, pairing an apple with a tablespoon of peanut butter can help balance out the carbohydrates with protein and healthy fats. Overall, a balanced and varied diet that includes plenty of fruits, vegetables, lean proteins, and whole grains can help people with diabetes manage their condition and improve their overall health. One diet works best for all diabetics. There is no one-size-fits-all diet that works best for all people with diabetes. The ideal diet will depend on an individual's specific health needs, preferences, and lifestyle factors. However, there are some general guidelines that can help people with diabetes make healthy food choices. It is important to focus on whole, nutrient-dense foods such as fruits, vegetables, whole grains, lean proteins, and healthy fats. Processed foods, sugary beverages, and foods high in saturated and trans fats should be limited. Research has shown that different diets may be effective for managing diabetes. For example, a high-fat, low-carbohydrate diet has been shown to improve blood glucose stability and reduce the need for type 2 diabetes medication in some studies. A Mediterranean diet has also been associated with better blood sugar control, heart health, and weight loss in research. Ultimately, the most effective diet for managing diabetes will depend on individual factors such as blood sugar levels, medications, activity level, and personal preferences. It is important to work with a healthcare professional, such as a registered dietitian, to develop an individualized meal plan that meets your unique needs and goals. Diabetics have to carry snacks. For people with type 1 diabetes, carrying snacks is important as they are at risk of developing low blood sugar, which can be life-threatening. However, for people with type 2 diabetes, it depends on their individual situation and the medications they are taking. Regardless of the type of diabetes, it is important to never go too long without eating, as this can cause blood sugar levels to drop too low. Having a small, shelf-stable snack on hand that contains about 15 grams of carbohydrates can be helpful in managing blood sugar levels and preventing hypoglycemia. It is important to work with a healthcare professional to develop an individualized diabetes management plan that includes guidelines for snacking and managing blood sugar levels. This can help ensure that you are managing your diabetes safely and effectively. The information provided is for informational purposes only and should not be considered as medical advice. Consult a healthcare professional or diabetes specialist for personalized advice and recommendations regarding your specific condition. Diabetes management requires expert evaluation and guidance tailored to your individual needs. Every individual's situation may vary, and the information presented here is not a substitute for professional medical care. Seek the expertise of a healthcare professional specialized in diabetes for accurate diagnosis and personalized treatment. Your health is unique, so consult a healthcare professional for proper management and support.